Good morning. Thanks as always to Jay and Vicki for interpreting this morning. We're going to run through the numbers real quick. Total positive cases in Hamilton County of COVID-19 stand at 58,503. The increase from last week, 4,124. Hospitalizations are up to 2,234. The increase from last week is 98. In the number of deaths in Hamilton County, sit at 426. The increase from last week is 4. So today we have Greg Kesterman, the Commissioner of Public Health here in Hamilton County with us as always, and Nick Crosley is here from the Emergency Management Agency of Hamilton County. We're going to talk about vaccines today and the process of how to get a vaccine and what we should expect here in Hamilton County and how we can, as quickly as possible, get folks vaccinated in Hamilton County. Greg will also obviously give his regular update. But I want to level set here for a minute, and let's talk about expectations. So the governor, in his press briefing, the one before yesterday's, talked about how we're working through 1A. We all know this. It's the medical professionals, it's the first responders, folks in congregate care settings that are elderly. Those folks are in the top tier, right? Those are the ones that are in 1A getting vaccinated as we speak. We're not finished with 1A. We're not getting enough doses to finish out 1A. Now we are moving to a second tier, which is folks that are over the age of 80 as of next week. What was said was that people over the age of 80 will be eligible to receive the vaccine starting next week. That is not the same thing as everybody over the age of 80 in Hamilton County will get the vaccine. They won't. We are not getting enough doses to make that happen. If we did, I mean, the systems are set up, and we just spoke to the hospitals a couple days ago. They could administer more doses, many more doses than what they're getting, but we're just not getting the doses. And to give you an idea of what that looks like, in weeks past and what we expect right now until we're told otherwise, is that city public health and county public health are both getting about 500 doses apiece. The hospital systems are collectively getting about 7,000 doses or so. Do the math. I mean, that's not near enough doses to complete 1A and start to finish out folks that are 80 and over. So I just want to be very clear that while we are standing at the ready to vaccinate as many people as possible, especially those at risk, those over the age of 80, until we get the doses, we're not going to be able to do that. And we are going to work through that population with the doses that we have. So I just want to, I'm getting a lot of questions about that, and I don't, I don't know how else to say it than this frustration that an expectation has been laid that is not achievable here in Hamilton County without the appropriate number of doses. And we're in the same spot as every other county in the state and every state in the union. Yeah, none of us are getting the doses we need to vaccinate the population that we have eligible. All right, so the county, the city, hospital systems, and some private pharmacies are going to be working to vaccinate those that become eligible next week. That is 1A, which we're still not finished with 1A, and individuals that are over the age of 80. We're not finished with that 1A group yet. So let's talk a little bit about those numbers then. So the idea is, and the governor has laid this out pretty clearly, the philosophy behind who's getting doses and who's becoming eligible is related to those who are impacted by the virus, that get it worse and might die from the virus. So what we know is that older people are much more heavily impacted by this disease or this virus. So 86% of the deaths in Ohio have been people over the age of 65. So that obviously is the population that we're targeting incrementally with the doses. That's the philosophy. I'm sorry, I'm jumping through my notes here a little bit. Let me put that in perspective related to Hamilton County. According to the latest census estimate, there are 126,000 people over the age of 65 in Hamilton County. About 28,000 of them are over the age of 80. So do the math. If we're getting about 8,000 doses in Hamilton County throughout the systems, and we've got 28,000 individuals over the age of 80, it's going to take about 4 weeks or so to vaccinate that population if they were the only ones getting the doses. But remember, we haven't finished 1A, and a week later, folks over the age of 75 are going to become eligible. And a week later, people over the age of 70 are going to become eligible. So you can see the challenge here. We are trying desperately to set up these systems to make sure people can get in line and get in the queue. But I don't want people to think that just because you're in the queue and eligible, you're going to get that dose next week or maybe even the following week. This is going to take a while. So the mayor and I have been convening the hospital systems weekly to collaborate. And this is what we know in terms of vaccines coming into Hamilton County. And I already mentioned this, that the hospital systems are getting some, public health are getting some, and pharmacies are getting some. The mayor and I will have an announcement on Friday at noon to talk more about how we are going to work together to get people signed up. So that's kind of the level setting conversation that I think needed to happen. At some point, we are hopeful that we will get more doses. I mean, you hear information coming from the federal level that talks about releasing some of the doses that are being held for the second dose for people that are already getting the first dose, right? And how the manufacturing of these drugs, we hope to see that ramp up. So we are hopeful that we will get more doses. We're just not there yet. All right, so I think with that, I'm going to turn it over to Greg. I don't mean to be so dramatic, but it is dramatic. I mean, people are so anxious to get the vaccine, especially those over the age of 80. I know, my mom's over the age of 80. I want to get her signed up. I want to know how to do it. I want to know where to go for that. And that's the kind of information that we are trying to push out to people while making sure the expectations are reasonable. So with that, Greg, I'm going to turn it over to you.
Good morning, and thank you, Commissioner. There's a lot happening in public health this month, and our team is continuously working very tirelessly to ensure that these projects in this pandemic are successfully managed. Today, I would like to start off by taking a look at our cases here in Hamilton County. Over the last month, we have had 2 peaks with our cases. One happened on December 10th, and the second looks like it just happened about a week ago on January 5th. So I'm glad to see some of those case numbers starting to trend back down. I really do believe that the second piece, the January 5th peak, was attributed to Christmas and some gatherings that might have happened around that holiday. I remain very optimistic that we'll continue to see these decreases continue. I will say that over the last 7 days, our case average per day was 569 cases. December 10th, that week, we had 716 cases per day. So we did start to see some increases, but it was not nearly as bad as it was back in the beginning of December. There does remain a whole lot of COVID in our community. There are 10,500 active cases of COVID-19 currently in Hamilton County. And I continuously remind folks that that number represents your chances of getting sick if you're out and about. While there's a lot of excitement and talk about the vaccine, just because there is some vaccine in our community, we still have to be extremely cautious. Looking at our reproductive number for the county, today we are at 1.07 for Hamilton County, and for the region we are at 1.06. Moving on to hospitalizations, remember that hospitalizations are a delayed indicator, and it can take a couple weeks for these to show up within our hospital system. So we are still watching this number closely. Over the last month, hospitalizations have calmed down, but they have not decreased. We are seeing about 750 patients in our regional hospital systems still here in Hamilton County and the counties surrounding us. So our hospital systems continue to have significant burden and a lot of stress on them and their workers. When you look to the intensive care units, the same thing is happening. We've not seen any decreases over the last month. There are about 200 individuals in our region's intensive care units. So we have a long way to go still before we get back to a comfortable spot for those two systems. And I think it's just a constant reminder that we must continue to be cautious in our daily lives. I'd like to move on now to talk about some of the work and activity that's happening with vaccine. It is important to remember and understand that we've said this from the beginning, but vaccine is in very limited supply, and we knew it would take a little bit to get distributed to our community. Ohio and health departments, we are just now finishing our 3rd week of vaccine. It seems like all we've been talking about, but it's only been 3 weeks. So I think we just need to continue to offer grace and understanding that public health, hospital systems, and private pharmacies are doing the best they can and are really working hard to make sure that we can get vaccine into the community. Since public health has started receiving vaccine, we are receiving on average about 500 doses per week, and that's consistent with what we received this week and what we're anticipating receiving next week. So it will take a little bit of time to continue to ramp up this effort. We're very hopeful that soon additional additional drug manufacturers will have vaccine approved at the FDA level, and that will help further assist us in getting more vaccine into our community. These vaccines, as we have said in the past, are being handled by a variety of providers. My office, Hamilton County Public Health, is only responsible for 500 vaccines. There are many more partners in Hamilton County that are working on this effort, including our hospital systems as well as CVS and Walgreens. Each of these providers have been focused currently on Phase 1A. As Commissioner Driehaus just shared, we are getting ready to move to Phase 1B, and that will be additional work, and we will work through that as we go. Before moving on to some discussion about Phase 1B, I wanted to share today my team is vaccinating 560 people in a large clinic. I'm making sure my team members are trained. It's been since 2009 since we've operated a large clinic. So 560 folks are running through a clinic today, and from my last report from my team, things are going very smoothly. And this time, compared to 2009, we're using technology, which is helping with some of the check-in process and the data entry process. So it's very exciting for my team. In addition, my team has been running clinics out of our Clifton office for additional days this week. So a lot of activity happening and a lot of moving parts, and I'm excited for the work that my team is doing. Looking to Phase B, Governor DeWine did say that there are 2 clear objectives with Phase B. First and foremost is to save lives. Those over 65 are certainly highest at risk. And then the second part of Phase 1B is to get kids back in school and to keep them safely in school. Per Governor DeWine, we will begin Phase 1B, but we will not forget those in 1A. We will continue providing vaccine for those individuals, but starting next week, we will start trying to get some 80-year-olds vaccinated and to get that older population the protection they need against this virus. I did find out late last night, and Commissioner Driehaus referenced this, but there are going to be 48 providers in Hamilton County that will receive vaccine next week for that 80-year-old population. They will be receiving a little bit more than 8,100 doses, and it will go to a variety of individuals. The partners include public health, our hospital systems, our federally qualified health centers, and then some local pharmacies will also receive vaccine. I am working with my team. We will get a list up by tomorrow that will show folks all of the pharmacies, so they will have additional ways to view who has vaccine. In addition, for the doses that we are receiving, the 500 doses Hamilton County Public Health is receiving, we have a registration on our website. We are working with that registration, and we will call those 80-year-olds that will have an appointment and actually schedule that appointment to make it as simple as possible. To our seniors, we do know that you are anxious to get vaccinated, and it is our tireless goal to ensure that each of you do get the vaccine if you want it. We are working very hard, and as doses come, we will get it into our community. I do know that there's anxiety because people want it now, and we are working to understand what kind of allocations we'll get in the future so that we can get vaccine to you. As Commissioner Driehaus shared, as we move each week, we will be increasing the number of people eligible to receive vaccine. If you are 80 and we move to the 75-year-olds, you will not be forgotten. There will be opportunities still to get vaccine each week for all of the individuals that are eligible. I do want to say thank you for your patience. We continue to work fast and hard. While we work through this pandemic, please do not forget to wear your mask, social distance, keep sick at home, and hand hygiene. These are the tools that we have currently to protect our community against COVID. Thank you.
Thank you, Greg. And thanks for the reminder that as we work through this, and as we get the vaccine out to those most vulnerable in our community, we do have the tools to stay safe. Wear the mask, social distance, wash your hands, do what you've been doing to make sure that we all get through this, people get vaccinated, and people stay healthy in the meantime. So thank you for that reminder, Greg. Appreciate it. So Nick Crosley is here as well. As you may recall, the governor identified the EMAs locally as agencies that would help coordinate the effort. And so we just want to hear briefly from Nick as to his role in the coordination effort.
Thank you, Commissioner. We've worked diligently throughout this pandemic to coordinate all 4 health districts in Hamilton County. I am personally in touch with all 4 health directors. As the vaccine comes into the county and for distribution by public authorities, we're providing the background support, the storage, and making sure that it can be distributed effectively. It's been offered to all 4 health districts. At this point, we are participating in the rollout of registration systems. We are gathering the information on how residents can get vaccinated, and we'll be distributing that information across all of our communication channels as we go forward. And of course, ensuring that if storage is needed by any of the health districts or any other providers, that they can reach us and we can provide support if and when it's needed. So I think the key here, as both Greg mentioned and Commissioner Driehaus mentioned, is patience. I anticipate the amount of vaccine growing as we have more providers come on board for the vaccine. I think that, as I mentioned earlier in this week in an interview with Channel 5, that if you have a private physician, you should stay in touch with your private physician on when they might have access to the vaccine. But then also, as the information is released publicly, all the media outlets will carry this information. And if people need assistance to work with their families on getting the vaccine, getting to appointments, getting registered, all that kind of stuff, I know that all the health districts are working on ensuring that there is equity and access to the vaccine, and that I anticipate those efforts continuing on until everybody is vaccinated. Thank you.
Thanks, Nick. All right, why don't we go to questions, Bridget?
Thanks, Commissioner. Up first is Jenna Cicero with Local 12. She has questions for you, Greg.
For Greg?
Good morning.
Hey there, thank you. Good morning. Thank you so much for taking our questions. So, hey, quick question for you. I know you were talking about the Hamilton County Vaccine Registration Survey. So, question for you, does that put you in a better standing versus those who didn't fill out that form, if you fill out that form
If you
early
could
on?
pause for 1 second. On our end, we're having an audio issue. Sorry.
Okay. Yes, so when filling out the Hamilton County Vaccine Registration Survey, does that put you in a better standing versus those who didn't fill out the survey? So, for instance, if I fill it out today and then my friend fills it out tomorrow, would I be ahead of my friend on that list?
Thanks for the question, and it's a great question. We are actually taking that list of individuals that qualify and randomizing them. We did not put out notice that first come, first serve, and we did not think it would be fair to grab those that might have registered a few weeks back. So it will be a completely random distribution of those called. On our survey, we have yesterday morning over 1,000 individuals that were 80 and older. And I can tell you in the last 24 hours, we've had over 10,000 individuals register on our website. So a lot of volume and a lot of interest, and we want to try and make this as fair as possible.
Thanks, Jenna. Up next, we have Ann Senker with the Inquirer. She has questions, I believe, for Greg.
Good morning, Ann.
Yes, thank you so much. So, Nick Crosley just mentioned, and you have as well, that the media are going to provide information about registration, and we would be delighted to do that, but we'd like to have some.
So I can only speak
So,
for, sorry, go ahead.
can you be more specific about what do you get when you register? And that registration form is kind of hard to find on the website. What does it get you? And given, I understand there's an extremely limited amount of dosing available. So how do you tell people to wait in line for this? I mean, how is this going to work?
Perfect. So I will say that we have received some feedback and have made adjustments. So I would encourage, if you've not been on our website in the last 24 hours, to check. We are working very hard to make sure that everything is accessible. What's accessible to me might not be the same for an 80-year-old, so we're trying to make sure that things are easy to see and easy to find. There will always be challenges, but we're trying our best. The form that we have on our website, the registration form, is a great way for us to collect personal information about those that are interested in getting the vaccine. And it's a tool that we are using to then be able to reach out to those individuals when we have an appointment available for them to come and get vaccinated. As we have stressed, I am only one provider of 48 providers that will have vaccine, and I'm making sure that our vaccine that we have at Hamilton County Public Health is as accessible and equitable to our community as possible.
Do you expect, Greg, that you're going to be, the governor yesterday is predicting that the deliveries that happen on Monday are going to go into arms on Tuesday, and the ones that come on Tuesday go into arms on Wednesday, and similarly, do you think that is a chain of events you can do this next week?
We are a little unsure what day vaccines are coming, and because we want to make sure we can schedule clinics, we will get all 500 doses into the arms of those over the age of 80 on Thursday and Friday next week. We are scheduling clinics for those 2 days. As mentioned during my remarks, we will actually take that list of registrants on our website, and we will call those individuals that we have enough vaccine for.
And you're going to randomize that, so as Jenny asked earlier, just because I signed up 3 weeks ago doesn't necessarily put me at the front of the line.
That's correct. When we found out there was a need for a registration form, we put this on our website and made it a tool accessible to the community. But just because somebody registered 3 weeks ago, we wanted to make sure that folks that are registering now that we're talking about it have the same level of access now that this phase has been announced.
Okay. All right, thank you.
Thank you, Ann. Next up, we have Larry Seward. He has questions for you, Greg, I believe.
Morning, Larry.
Good morning, Greg. Also for Nick and Denise. How are you ensuring equity and access to hard-to-reach populations? And specifically, given that there's a registration process, what about people that have limited access to digital technology? How are you ensuring that they have equal access?
Very good question. You know, I am not widely advertising that you can call our office, but we do have a list started as well for people who do not have computers. I share this very cautiously. We had in the last 24 hours, we had 10,000 people register on our website. If we had 10,000 people call our office, our phone lines would be shut down. But if you absolutely have a need and are unable to use the internet or unable to have someone assist you using the internet, you are able to call our office. Our number is 946-7800. But I plead with everyone, try your best to use our website, as it's a very effective tool for capturing this information. Those two lists, the list of people that call our phone and we type it out, will be merged with the list that's on our website. So calling us does not give you a better opportunity or a lesser opportunity to have access to the vaccine.
And what about those that are geographically hard to reach? Are there lessons you learned from 2009 with sort of distributing vaccine? And secondly, from those lessons, what characteristics of this particular vaccine, i.e. cold chain, make distribution a challenge that you're working through?
So the first part of the question, so far all of my vaccine clinics have been on bus lines. I can tell you that the 48 providers that will be in Hamilton County starting next week are geographically distributed throughout the county from east to west and north to south. there are a lot of opportunities and a lot of opportunities to get to these clinics from public transportation. So I think we're doing the best we can at this early phase. I think there may be longer term some opportunities for home health workers to be part of the distribution. We know that many of our elderly are not mobile, so I think we're working through those pieces. But at this early phase, we're getting the masses vaccinated as quick as possible. Forgive me, I forget the second part of your question.
Yes, the characteristics of the vaccine, such as cold chain, how does that challenge distribution in sort of hard to reach areas?
So far, the vaccine that public health has received has been the Moderna vaccine, which has the ability to be refrigerated for up to 30 days, and logistically there's been no issues. What we plan to receive next week is 500 doses of Pfizer vaccine. That vaccine does have a little bit more technical nature to it, but the good news is the governor is giving us 7 days to get rid of it and to get it into the arms. And so I have 5 days to keep that vaccine refrigerated, and we will get that job done.
Last question for you, Greg. Also, Denise and possibly Nick. First responders that are waiting on their second dose, are they delayed right now because we don't have enough vaccine?
Wonderful question, and I failed to mention that. We are receiving doses for our first responders that we talked about a few weeks ago. We will receive those doses this week, and my team will follow the same distribution model we did last time, where our first responders will take care of vaccinating themselves. So it's kind of like a twofold task right now for public health. We'll be managing both processes.
So to be clear, they will not face a delay in getting their second dose because we're trying to get vaccine to more people.
That is accurate. There will be no delay for our first responders or anyone at this point. Anyone who got vaccinated one time will have an equal opportunity to get their second dose of vaccine. That's built into our strategy. I'll turn it over to Commissioner Driehaus.
Yeah, I'm just sitting back, letting Greg take all the questions. Did you have a question for myself or Nick?
Well, I would love your input on sort of making sure that distribution is equitable and people in hard to reach areas geographically are going to have access, because those are questions people have. If I don't have access to a computer, how is it fair? How am I going to be able to get this vaccine?
All right, so as I mentioned, as a bit of a tease, on Friday at noon, the mayor and I, along with members of the hospital system, are going to introduce what we've been working on, which is what you're talking about, kind of a collective effort to have easy access to get in the queue for the vaccine. So it'll involve online opportunities. It will also involve a hotline. So we're trying to make it as accessible as possible.
Will any aspect of this, for those that are old enough to remember polio vaccine distribution, will there be any similarities to that plan?
We're all saying we're not old enough to know. No, I'm just, yeah, there are a bunch of head shaking no. Thank you.
Thank you.
Thanks, Larry. Next up, Corey Sharber with WVXU, and it looks like he has questions. I'm not sure who he has questions for. Corey, who would you like to ask?
I'll have a question for Greg for my first question. Of course, Denise mentioned that the county wasn't getting enough doses for Phase 1A. And of course, now that Phase 1B is getting ready to go into effect, I'm not trying to fearmonger here. I'm just asking, out of concern. I mean, if the county's not getting enough doses now, does this set a scary precedent for the county's recovery going forward?
So, Corey, I think what I hear from the governor's office is the goal is to save lives, and we know those over the age of 65 are most likely to require hospitalization should they get COVID-19, or also the most likely to die from COVID-19. And so the goal is to quickly get vaccine into that community. The priority 1A really focused on those in congregate living, which were hit the hardest, but it also focused on our medical professionals to start making sure we had enough safe and healthy medical professionals to help take care of the population. The governor wanted to start on 1B, those 65 and older, so that we could start saving lives. But the truth is we are not forgetting those in 1A. We will continue to work through those in 1A as vaccine comes. Governor announced a few things yesterday, I believe, during his press conference, including the possibility of opening up second doses and getting those into the arms sooner. I don't have all of those details, but I know some of these strategies will get more vaccine into our community quicker.
And I just wanted a quick follow-up on contact tracing within the region.
I kicked
guys-
Greg out. Corey, hold on one second. I kicked Greg out for a second. So let me just say that, the governor talks about the statewide strategy, and the counties in the state are really different from one another. So there are some counties that the 1A population is a manageable population related to the doses that they're getting. The metro counties are a little different because our populations are so high and those numbers are so high, and we're having a hard time keeping up because the doses just don't meet that. It's not that we're trying to fearmonger or place blame or anything. I just want to make sure that when people hear that they're eligible come next week to get the vaccine, that with the limited doses, that does not mean they're going to necessarily get the vaccine. They simply are eligible and need to get in the queue. So I think it's complicated because the state is so diverse. So in Hamilton County, we're trying to keep up and do our best with the number of doses we're getting, and we're optimistic that we're going to get more here in the future. So sorry, I didn't mean to interrupt you, but a statewide strategy and the strategy in Hamilton County look a little bit different because of the nature of the diversity of the state. Sorry.
I'm back.
Welcome back, Greg. I wanted a quick update on contact tracing within the county. I was wondering if, because cases have gone up this week, have you guys been noticing any specific hotspots?
We have not. Really, the cases continue to be spread throughout the county. And actually, as the cases now are starting to come back down a little bit, we are starting to feel relief, my teams. We built the capacity to manage what we were seeing back in December 10th. And so as cases now are about, what I think I said, about 150 to 200 less than they were on December 10th, our team actually has a little bit room to breathe and to start managing cases at a more comfortable level. So things are going smooth that way as well.
Yep. Thank you.
Corey, next up we have Brian Hamrick with WLWT Channel 5, and he has questions for both commissioners.
Greg, how are you today, Greg?
Good.
Good to see you. I'm trying to figure out exactly kind of even where to start because, we're hearing on the federal level that they're going to be, injecting massive amounts of dosages. We're going to be getting these things, and they're supposed to be coming down the line. Have you heard anything from the federal folks? Is there a big disconnect from what they're saying, then down to the state and to where you are?
So my line of communication has been throughout this pandemic directly with the state. And at this time, the state is indicating they're expecting more doses, but no predictions yet for how many doses we might see throughout Hamilton County. I did mention that there are 48 providers that will get vaccines starting in 1B. There are additional providers in Hamilton County that have registered and been approved by the state of Ohio that are ready to accept vaccine beyond those 48. And at future points in this distribution, those additional providers will be used. So if we see a significant increase in vaccine, I would anticipate the state would use all of those providers to help make sure we can quickly get it into Ohioans.
And how many doses do you think, if they delivered truckloads of this to Hamilton County tomorrow, how many doses do you think you can do in a day or say even in a week? I mean, for the whole county.
It does take a moment for me personally, my team personally, to staff up. But generally speaking, we built the same model that we did for contact tracing. And you may recall many months ago, our contact tracing model is essentially a team leader and then 5 or 6 people working under that team leader. That same model we have right now, we have a team leader that's a nurse and then 5 or 6 people underneath that nurse that are able to vaccinate. And by building the model in that way, it gives me some flexibility. I don't want to purchase a bunch or hire a bunch of nurses today if I'm only receiving 500 doses. But if next week they say I'm going to receive 1,000 doses, I do need to be able to scale that model. And so we would bring in another team and go from there. We do have a list of nurses that are ready to work with us, and so we're not anticipating any hiring issues. So the biggest piece is getting information to us so that we can be prepared once vaccine is available.
And what's that look like in terms of numbers?
Each team can vaccinate, I think, about 1,200 people per week.
And how many teams are there?
I have 2 teams currently, which means I have excess capacity currently.
Okay, so but you're saying maybe 2,400 a week at max capacity, but that's just for Hamilton County, right?
For my agency, there's 3 other health departments in Hamilton County. There's 10 hospitals in Hamilton County, The state announced 27 pharmacies are going to be vaccinating, so that's just my piece.
Does anybody have a grip on the big picture as to how many could actually, if we start getting these, shipments of vaccine that we're hoping, or at least they're talking about, anybody have an idea on the big picture of how many we might be able to do in a week?
I have
What that might look like?
Yeah, I have not heard the state estimate on how many we will receive at any point in the future. But I can tell you, Hamilton County as a whole, whether it be our agency, the Hamilton County Public Health, the City Health Department, or any of the other partners in Hamilton County, we're ready, and we accept the vaccine, and we will get it into the community as soon as we get it.
The other thing I was asking about is this randomization. How does that work? Is that a machine? Is that somebody just picks a number out of the hat? I mean, how are you going to do that?
We use statistical analysis software. My epidemiologists run it, and it gives us a list of individuals to call in order.
Yeah, I mean, but how does it work in terms of, say, well, this person's like 89, so they rank higher? Is there a ranking, or how does it work?
Anyone over the age of 80 is included, and it will randomize anyone over the age. There's no priority given per the governor. Anyone over 80 is equally ranked, and so there would be no additional priority given.
So it goes into a machine, it picks a number randomly then out of that 80 plus?
That's correct.
And that's how it works. The other thing I wanted to ask you about was, let's see. I'm sorry. I had written down a couple of things here, and I don't want to ask you all of them. I think Ms. Driehaus, I wanted to ask about this, what we might know about this access and the hotline and what more can you tell us about how that's going to work? And because at this point, it sounds like, we could have CVS, we could have Walgreens, we could have the county, the city, some of these other providers. I mean, I can see where people will be confused about how am I going to go? How am I going to know where I go? How am I going to get a hold of people? What else I know you got the big announcement on Friday, but what else might you be able to tell us about what to expect with this announcement?
Well, yeah, so you've identified why we're doing what we're doing, because we are trying to reduce the amount of confusion as to how you get signed up and in the queue. And so the city, the county, hospital systems have been working together for a few weeks now, trying to figure out how we can collectively have a site of entry, and how we make it accessible by way of a hotline and a website, so that people can sign up. So we're going to announce it on Friday. I don't have any additional details at this time, but the whole idea is to reduce the amount of confusion for folks in Hamilton County so they can get signed up and in the queue. One other thing I wanted to mention, you asked Greg about the capacity. If we were to have a truckload of doses arrive tomorrow, we would all jump for joy and celebrate. But the truth of the matter is we do need to ramp up for that. And so the idea is to get that information and then be able to ramp up. On behalf of the hospitals, though, I've heard them say that these systems, and remember there are a number of them in Hamilton County, could vaccinate thousands of people in a week. And so more to come on that front. If that question needs to be answered on Friday, we will do that because they will be standing there with us. But we do have capacity, obviously, in the county to do more than the amount of doses we're getting. And so that's why we're anxious to get more and to make sure that we are ramped up to accept them when we get them.
And there's no really pre-warning of when you might get. I mean, there could be 10,000 doses coming to you tomorrow, or maybe the next day, but you'd have no. From what I'm hearing from other health departments, there's not a lot of pre-warning on this.
So there's. I mean, I'm looking at Greg. There is a little bit of like a couple days, I think, before, we are told how many doses we're getting. And then we say, okay, let's get a couple days. Let's get those out as quickly as possible. So it is true to say, it's part of the logistics challenge of doing this without knowing at every level how many doses are going to be made available week to week. And that does create some confusion in the broader community, I'm afraid. But anyway, it is what it is, and we're working through it.
And we're talking about doing these, they're using the one dose. We'll get the one dose at the federal level, then we'll worry about the second dose later. Does that give you any cause for concern at all?
I think the idea is to make sure that, because remember the second doses were being held back, and they are being held back. I think the idea is to expect that we will continue to get those vaccines in at the federal level, and so start to disperse that first dose more broadly so that we can get more people vaccinated as quickly as possible. I mean, I know that's the philosophy behind it.
What do you think of that?
Well, I think we want to get as many people vaccinated as possible, as quickly as possible. So I think we just have to depend on the federal government to get those vaccines in and disperse them as quickly as possible.
All right. Hey, thanks a lot. I appreciate you taking time out.
Thanks, Brian. Next up, we have Liz Engel with the Business Courier. She has questions for you, Greg.
Good morning, Liz.
Good morning. I'm really curious the demand overall that you're seeing on the registration site. The numbers you mentioned, were they just for yesterday, or how many total people have taken advantage of that system?
I believe since we put it up three weeks ago, I believe our total number exceeds 35,000. And yesterday alone was the 24-hour period that I referenced where we had about 10,000 registries.
And then the population, the 80 plus, was 1,000 just yesterday?
No, that was 1,000 throughout the entire 3-week period that the site's been up.
Okay. Yeah, so there's probably a lot of other outreach that needs to be done for that age group, and it sounds like you guys have some plans for that.
Yep, that's correct.
I have also, we said kind of the randomization. Are pre-existing health conditions being weighed in any of that?
No, at this time, the governor's plan calls for anyone that is age 80 and has not offered additional prioritization beyond the age. And so we are following very closely the governor's plan.
Okay, that's all I have.
Liz, Commissioner Driehaus is sharing that the City of Cincinnati, in addition to Hamilton County Public Health, also has a registration process available on their website. And so the numbers that I'm sharing are just for Hamilton County. We might have city residents registering on our website, but in addition, there's another list being maintained by the City of Cincinnati Health Department.
Okay.
Thanks, Liz, and that seems to conclude our questions from reporters.
All right. Well, I want to thank Nick and Greg, as always, for being here. So thank you all for being part of the effort to make sure people are well informed in the community related to the vaccine. So we are guardedly optimistic about the future here. We're at a bit of a point where we're getting a certain number of doses. We're vaccinating people as quickly as possible, but the doses simply don't match the population that's eligible. It is what it is. We're working through it. We hope to get more here in the near future, and so we're ramping up in all sectors to address the need. So more to come on Friday. Again, Friday at noon, the mayor, myself, the hospital systems will be talking about this common effort to try to make sure that the confusion is eliminated by having a common way for people to sign up. So more to come on that, and we'll see you on Friday. Thanks.